Have you ever wondered how a casual indulgence can spiral into an uncontrollable craving? Welcome to the complex world of addiction. An addiction is a psychological and physical inability to stop consuming a chemical, drug, activity, or substance, even though it is causing psychological and physical harm. It's not just about drugs or alcohol. People can become addicted to many things like food, gambling, shopping, or virtually anything else that alters our mood or state of consciousness. Delving into the numbers, the World Health Organization estimates that about 300 million people globally suffer from addiction. That's almost equivalent to the entire population of the United States. And it doesn't discriminate, affecting people of all ages, races, and social classes. In the United States alone, nearly 21 million people have at least one addiction, yet only 10% of them receive treatment. An alarming statistic, isn't it? And let's not forget the financial burden. The societal cost of addiction is staggering, with the United States spending over $600 billion annually on healthcare, crime, and lost productivity related to addiction. But what causes addiction? Well, it's a combination of genetic, environmental, and psychological factors. Certain people are more susceptible due to their genetic makeup, while others fall victim to their environment or psychological state. Treatment for addiction varies and is tailored to the individual's needs. It may involve counseling, medication, or a combination of both. Recovery is possible, and many people successfully overcome their addictions. But it's important to remember that it's a long-term process that requires patience and commitment. Let's delve deeper into the treatment options for addiction. Understanding these options is key to knowing what might work best for an individual. First, we have detoxification. This is often the initial step in many treatment programs. It's performed under medical supervision, and it's aimed at clearing the body of harmful substances. This process can be physically demanding and should be done with professional help. Next, we have behavioral counseling. This is a crucial aspect of treatment. It helps patients engage in the treatment process, modify their attitudes and behaviors related to drug abuse, and increase healthy life skills. Counseling can be individual or group-based and is often a long-term process. Medication is another treatment option. Medications can be used to manage withdrawal symptoms, prevent relapse, and treat any co-occurring conditions. The type of medication will depend on the individual's specific needs and the substance they're addicted to. Lastly, we have long-term follow-up. This is essential to prevent relapse and maintain sobriety. It may include attending regular community or clinic-based recovery support groups. It's important to remember that recovery is a lifelong commitment. Remember, treatment plans need to be reviewed often and modified to fit the patient's changing needs. No one-size-fits-all solution exists for addiction, and it's crucial that treatment is tailored to the individual. Let's discuss impact and hope. Addiction is a complex condition that affects millions of people worldwide. It's not restricted to substances like drugs or alcohol, but can include any activity or behavior that alters our mood. The statistics are overwhelming, with only a tiny fraction of affected individuals receiving the necessary treatment. The societal cost is staggering, impacting not only the individuals but also their families, communities, and society at large. However, there is hope. With the appropriate treatment and support, many individuals can and do triumph over their addictions. But it's a long road that demands understanding, compassion, and patience. Remember, addiction isn't a choice or a sign of weakness. It's a chronic disease that requires our attention, understanding, and empathy. Let's shatter the stigma and illuminate the darkness of addiction. In our journey to understand addiction, it is essential to take a closer look at the various treatment options available. Firstly, we have inpatient rehabilitation. This is a residential treatment center where patients live full-time. It provides an immersive treatment environment with medical care and therapy, allowing individuals to focus solely on their recovery. Next, we have outpatient rehabilitation. This is similar to inpatient rehab, but patients live at home and attend treatment during the day. This option gives flexibility for those who may have work or family commitments but still require a structured treatment program. Support groups also play a crucial role in recovery. These are peer-led organizations that provide a safe space for sharing experiences, gaining advice, and receiving encouragement during recovery. Remember, you are not alone in this journey. Lastly, we have holistic therapies. These include techniques such as yoga, meditation, and acupuncture. They can help manage withdrawal symptoms, reduce stress, and promote overall well-being. These are just a few of the many treatment options available. It's crucial to remember that there is no one-size-fits-all solution. Each person's journey to recovery is unique, and therefore, the treatment must be tailored to their specific needs and circumstances. It's all about finding the right fit for each individual's unique situation.